guys, Dr. Rachel here with Hutchinson Chiropractic. I wanted to pull out the camera today and show you something that I thought was pretty interesting. We see it all the time, but a lot of times patients get surprised when I show them their x-rays, and they'll find some surprising things on there. This patient was just reviewing his films. He came in this morning for his initial evaluation, and he's actually been to the hospital not once but twice for some real severe symptoms of sciatica. Okay, so that's that lower back pain that shoots some sharp knife-like sensations down into your leg. It can get really bad sometimes and make it a little bit difficult to walk, and actually just to be able to walk around and go to work and do the things that you have to do right every day. So one of the things that I noticed when I was reviewing his x-rays just now is that when we look at your patient's spine, or any patient's spine, we want to make sure that when we're looking at it from the back like we are now, that there's no bends in our spine. The hips are level and the spine is actually straight. Okay, and one of the things that we see here for sure right off the bat is we have a pretty good bend in his lower back. Okay, and so the reason why we don't want to see that is because when we look at the spinal structure, we have something very important that lives inside of our spinal column. That's these very delicate spinal nerves or spinal cord that lives on the inside. So we want to make sure that everything is lined up, one vertebrae on top of the next, without any type of lateral bend or twisting or anything like that. And what we're seeing in his case is that we actually have the vertebrae twisted off to the left, and then we've got this bend on top of it, which is very strange. But very common at the same time. So when we see that, he's putting a lot of pressure on the nerves and actually causing quite a bit of stretching and strain on the spinal cord, as it is very delicate. And so I wanted to point that out. Another thing I wanted to show you, because this is another reason why we take x-rays, is sometimes we can be born with conditions in our spine, genetic problems that actually are strange. So sometimes patients will come in and their vertebrae are fused together. Sometimes patients will come in here and the back part of the vertebrae has not been properly fused together. As you look at this spine here, we all have these little stegosaurus looking things on the back, and when we are born, our vertebrae, each little spinal bone starts off as several different pieces, and as we mature and become an adult, they should fuse together to one solid bone, and they all unite in the back. So when we come over here and look at this patient, it looks like we've got a fracture or a break in the bone, but really that's not what that is. That's just a condition we can be born with, where the vertebrae does not unite and fully come to complete fusion in the back. Okay, so Layla's going to zoom in so you can see that pretty well. Again, it looks like a fracture or a break in the bone, but it's not, and doesn't really have any clinical significance that's extreme. But we do find oftentimes that patients that are born with this have a much weaker lumbar spine or lower back, and so it can cause problems as far as sometimes we'll see some bending attached to it up top because it's not supporting the rest of the spine like it should. And overall, it just creates a general weakness in the body. We have to give patients lots of exercises to help support that. And this patient, believe it or not, was sent to us and had already been told that his spine was normal and there was nothing wrong with it. Okay, he had x-rays taken in a couple different places, and they said, you know what, your back's fine. There's nothing wrong with your spine. Just take some muscle relaxers and some painkillers. Guys, we see this all the time, and it's unfortunate. So I wanted to show this to you today because a lot of us out there have some lower back problems. It might not be in their lower back, but it could be their neck or wherever it may be. And we've already been told, we've been to not one doctor, but maybe a couple different ones. We've already been told, hey, you're normal, there's nothing wrong. Just take some of these medications for the symptoms and it should go away. Well, let me tell you, we see this all the time. They come to our office and we take x-rays and lo and behold, there's a problem. So I don't want you guys to feel hopeless. If you've been told a couple of times, heck, even if you've been told 10 times that you're normal, keep searching, okay? Keep looking. Maybe see your chiropractor. That's definitely a good starting place. And C, don't give up, okay? Because if you're not feeling right and you've had these symptoms for a while and you know in your gut that something is wrong, then you're probably right, okay? Just like this patient. He kept on our pursuit to find out what his problem was. We found it, and now we're going to get this guy fixed this afternoon. All right, guys, have a good one.